Mike, my name is Jill Chris. It's nice to meet you.
Nice to meet you.
Thank you for sitting down with us today.
Absolutely.
What have you been struggling with that made you seek out Hyperbaric?
I would say it starts through like the network that I have through the Special Operations Network. There was the folks that go the psychedelic route or the folks that were going the hyperbaric route. The two were highly recommended and recommended the most by the people that I either work with or used to work with.
Right.
And since I have a security clearance, I can't do the psychedelic route. So the oxygen route made a lot more sense. And just back a little bit, I did 30 years in the military, retired 2 years ago. Most of it was in Explosive Ordnance Disposal, EOD. Been through the Intrepid Spirit and the NICO path, identifying things and injuries that occurred along the way. Some of those TBIs, going to the chiropractor sometimes twice a week, things like that. Sleep.
What were some of the primary, and I think you were just getting ready to get to it, what were some of the primary symptoms that you were having that you were hoping that this would help?
I felt that if you look at the catalog and what the potentials are with this type of therapy, and you can check off a whole bunch of them and go, yeah, I think any of those would be great, just one. But getting better sleep, because I think sleep is vital just as much as oxygen and food are.
Absolutely.
And I think the better quality you get with that, it just rolls into a whole bunch of other things. And I've noticed through this that my sleep quality and quantity is much greater than it used to be. And I've been through multiple sleep studies, and I don't thrash around as much at all. I don't wake up as often, and I just get a lot better sleep. And I think that rolls into a lot more energy at 51. Well, I have younger kids, so going out and being able to, without thinking about it, saying yes and just going and doing it. And where before that might have been a little bit of a struggle. The other thing I felt, like I said, going to the chiropractor twice a week sometimes, at least once. Maybe get a day of relief out of that. Back pain and neck pain. This has by far been the best solution for my back pain so far. I think there's also cognitive too. Funny thing is I get in there and read a lot of times. It's been cognitively a lot easier for me to read. I think I don't know if the fog's clearing. I haven't run another cognitive test following this yet, but I feel like I would do better.
Yeah.
Because I think there's diagnosis with ADHD and brain injuries. There's a lot of commonalities between those symptoms, and I think that I would put on some medication, and I honestly haven't been taking it that much anymore. So
awesome.
Yeah.
That's a great outcome.
Yeah.
So what would you say to anyone that was on the fence about coming to do hyperbaric with similar symptoms as you?
I think you got to try it. I encourage a lot of my coworkers to just give it a try, and I think you're going to feel, because the thing about if you had I had chronic headaches, and I didn't even really know it until I went and they basically got rid of them for a period. So you never know really how much pain you're in until you're not in it anymore. And so I think this is one of these types of therapies that you may think you feel pretty good, but what if you're actually just going to do this and see what you felt like on the other side after you did 20 or 40 or however many treatments that you need to go through your protocol.
I like that. You may not even know how much pain you're in until you're not in pain anymore. That's amazing. Anything else you'd like to say?
I just really appreciate the opportunity. I think I got 2 more dives left out of 40, and it's been a game changer.
Awesome.
It's great to be afforded the opportunity to go through this program.